lymph. But at night, something different happens. When you fall deep asleep, your brain actually goes into cleanup mode. The spaces between the brain cells actually get larger. Fluid begins to flow through the brain, washing away waste products that build up during the day. Some of those waste products include proteins, amyloid plaques, these things sound familiar, and things that are linked to memory. So the lymphatic system is essential. Problems with cognitive decline can be tied back to someone that sleeps poorly. So sleep just isn't rest, it's actually maintenance for your brain. So the fascinating part is that the lymphatic system in the brain doesn't work alone, as most systems in the body do not. They're all very interconnected. After it clears out the waste, that waste drains into the lymphatic vessels in the neck. From there, it enters the lymphatic system and is removed. So the two systems actually interconnected are your brain's cleanup system and your body's cleanup system. Movement during the day to keep lymph flowing, and a good night's sleep to let your brain clear itself. If you've ever had just a night where you got a couple hours less sleep and you wake up kind of brain fog, or in my situation, my husband comes at me first thing in the morning, I have no idea what the words are he's even saying because my brain hasn't had a chance to clear. My face is puffy sometimes because I didn't sleep well. I have 8 dogs, by the way. I don't sleep well most of the time. But that movement at night helps clear that from your brain. So you can walk around and in a few moments you can start to understand and process things. That is just a movement of the lymph clearing out of the brain and other places. So sleep helps clear the waste, and when both are working well, you tend to feel less stiff, less swollen, mentally sharper, and every time you walk or do a balance exercise, you're helping your lymphatic system. So movement by day, sleep by night, and that's your body's cleanup system. Speaking of movement, I would be remiss if we didn't move. So we're going to do 20 minutes of movement. You can participate or not. It's your choice. I'm sorry, not 20 minutes. 20 seconds. Someone got a good night's sleep. So from your chair, just make sure you don't kick your water or your coffee over. And these are simple things. I show you this more than just to make you do something, but these are things that you can do. If you're sitting at a desk, you're sitting in your chair. So for 20 seconds, we're going to do something real simple. It's just leg extensions. You're going to extend the legs and bend the knees. So I'm going to guess what 20 seconds feels like. I might keep talking. You just keep moving. So seated leg extensions. Yeah? Something simple. We can all do it. You're going to find out in another slide how important that consistent movement throughout the day is versus just one long exercise session. That's probably 20 seconds, yeah? Alternating knee raises. Knee up, knee up. There was a piece of literature I read that this is one of the best movements you can do because it gets movement in the hips. There's a lot of vessels, muscles that all connect there at the hip joint. Yeah. You got groaning going on? Oh my goodness. You guys need to come see me for sure. Seated calf raises, just pushing up onto the toes, getting those calf muscles to contract. Up and down, up and down. You'll find out in another slide that the calf muscle is like the second heart. It's very important. That could be a whole nother lecture. And then for 20 seconds, if you're comfortable, those of you that are sitting in a seat behind another can touch the seat in front of you, but just stand up. And sit down. And stand up. Everybody's squatting, right? Stand up. Sit down. All right, just 3 there. I won't make you do 20 minutes. If you weren't able to sit down and stand up, come see me. I have a plan for that. All right. So now that you understand some of the basic biology of how the lymphatic system works, and you've done some movement to support your own lymphatic system, we'll get back to the science. Why the lymphatic system resonates with seniors specifically. Many older adults notice swelling in the legs, ankles, and feet, especially by the end of the day. It's often called edema. It becomes more common with aging and for several other reasons, but as we get older, we spend more time sitting. We may move less throughout the day. And remember, the lymphatic system doesn't have a pump like the heart. Instead, it relies on those muscle contractions, breathing, regular movement to keep fluid circulating. So when muscles are not contracting regularly, the fluid collects in the lower limbs. Gravity, we've got gravity to fight against too, right? Gravity's pulling fluid down. Your circulation is diminished, and so you get increased swelling. The encouraging news is, again, movement is the answer. It's the natural pump. Even gentle activity, like ankle pumps that we did, seated, walking short distances, which I know everyone's doing after their evening meal. Yeah? All right, all right.
Gotta go home.
Light, maybe walk a little further than that. Light strength and balance exercises. Deep diaphragmatic breathing. In my yoga class, we do this. How do you know if you're diaphragmatic breathing? Because your belly, your low belly is moving out and in. Your diaphragm is moving out and in. There are intricate systems, part of the lymph system around the diaphragm, which we won't get into that, but it's the reason why that deep diaphragmatic breathing helps the drainage. Other factors that might contribute to swelling would be venous insufficiency, and people that have vascular issues, and certain medications. So while lack of movement isn't a be-all, end-all, it is a huge contributing factor. Number 2, immune function and illness recovery. I've heard people say, and even myself, well, I just don't recover like I used to when I was younger, whether it be a wound or from an illness. The lymphatic system is also central to the immune system. It acts as a surveillance network. It transports immune cells, filters pathogens, and helps the body recognize and respond to infections. Lymph nodes, which you're all probably familiar with, although you have many of them, we know about the ones in the neck because they can get swollen, behind the ears, under the arms, the groin area, or some of the bigger ones. These lymph nodes are biological checkpoints where immune cells identify viruses, bacteria, and abnormal cells to coordinate an immune response. As we age, the immune system naturally becomes less efficient, a process known as immunosenescence. That's a big word. Seniors also experience increased baseline inflammation, also known as inflammaging. That doesn't sound good, which we'll cover more in another slide. So what can we do to combat this barrage of issues? Raise your hand if you want to guess. I've given you the answer many times. Yes.
Exercise.
Movement. Yes. Regular movement. There's an underlying message. You guys getting it? All right. Muscle contractions, because this all helps the lymph. It's what the lymph system depends on. So that supports your immune cell circulation and function. So when you're moving or exercising, you're not just doing it to build muscle or some aesthetic reason. You're actually boosting your immune system. The research here by, I'll probably butcher his name, Zolgich. This review explains how aging reduces immune surveillance and responsiveness, and how movement dramatically increases all of the functioning of these systems. So that's pretty impressive. Number 3, detoxification and inflammation. As I previously mentioned, inflammaging. We'll dive a bit deeper now. Inflammaging is a scientific term used to describe low-grade chronic inflammation. In science terms, it's used to describe inflammation that's not from an acute injury or an infection. It's just low-grade, constant inflammation. Unlike short-term inflammation that helps us heal, right? You get a boo-boo, it gets swollen. That inflammation has healing properties, but this inflammation isn't throughout your entire system. So it can develop over time, even without a clear illness. What causes inflammaging? Several biological factors contribute to this. The aging of the immune system, immunosenescence, accumulation of cellular damage, right? The lymphatic system not working as it should, and over time, these cells accumulate oxidative stress, misfolded proteins, mitochondrial dysfunction, and all these changes trigger inflammatory pathways. Could be from senescent cells. Older damaged cells can enter a state of senescence. They're dormant. They're not dead, but they're not performing their function any longer. These cells stop dividing, but they release inflammatory chemicals known as SAPs. Changes in the gut microbiome. Age-related shifts in gut bacteria may increase intestinal permeability or leaky gut and cause systemic inflammation. So why inflammaging matters? This chronic low-grade inflammation is associated with so many age-related diseases: cardiovascular disease, type 2 diabetes, Alzheimer's, osteoarthritis, sarcopenia, frailty. So the research suggests that inflammaging is one of the core biological mechanisms of aging. It will influence both lifespan and health span. So not just the number of years that you live, but the number of years that you live in a healthy, prosperous condition. So lifestyle, where's the good news in all this? The role of lifestyle. Studies show conclusively, without question, that lifestyle factors can help reduce chronic inflammation. Anyone want to guess the top two? There's number one, we got exercise. What's number two? And sleep, yes. Move and rest, that's exactly it. So again, regular activity and adequate sleep help the anti-inflammatory processes within the body. They help body composition, stress management. These factors support immune regulation, mitochondrial function, and they reduce inflammatory signaling. Number four, you might not have even thought this was associated with your lymphatic system, but mobility, balance, and fall prevention. As I've repeated throughout this presentation, the lymphatic system relies heavily, completely, on muscle contractions and movement to circulate the lymph fluid. With aging, loss of muscle mass, also known as sarcopenia, increased sedentary time, reduce the effectiveness of the muscles to contract forcefully. So not only do they atrophy, they lose their ability to contract with proper force. When muscles contract less frequently and with less force, lymph circulation slows, fluid accumulates, and joint stiffness and discomfort increase. The research is overwhelmingly clear. There's an article by Lane et al. Regular physical activity improves circulation, reduces swelling, enhances joint function, and supports proprioception. Proprioception is your balance, your brain knowing where your body is in space and time. Those are all key factors in fall prevention. They help maintain balance, coordination, and reaction time. So even gentle, consistent movements such as walking, strength exercises, balance training, seated ankle pumps, which we just did, super simple stuff you can do anywhere, can stimulate lymph flow while improving stability and confidence throughout your day. Oh, the comfort trap. So what happens when we get stuck in the comfort trap? It may not be a couch, maybe it's a lazy boy chair. There's a lot of those around here. So when we stop moving, because the body is designed for frequent low-level movement throughout the day, bad things start to happen. We get the lymphedema, the swollen lymph nodes, all of these things that are a part of that lymph system not working the way that it should. Interestingly enough, research shows that when we sit for long periods of time, that lymph flow decreases, blood circulation slows, glucose control worsens. So as you are more sedentary, your body's less able to manage the glucose that you're putting in through your diet. Two research articles that I found had a comparison. One, daily workout versus frequent movement. So person A exercises once a day, 30 minutes, maybe an hour, but the rest of their day is sedentary, in a chair, wherever. Person B performs person B does not perform one set exercise session of the day, but moves more frequently. Whether that be they set a timer every hour they get up and they do 10 body squats, or every hour the watch says, hey, it's time to get moving, and you get up and take a short walk. Person B fares way better than person A. So even though person B is not going to the gym and doing a set exercise program, They have more movement throughout the day, which has a better outcome on all of these systems. Short movement breaks improve blood sugar control, reduce insulin spikes, improve circulation, and reduce inflammatory markers. And I mentioned this as we were setting. When you set for long periods of time and the calf muscles aren't contracting, your venous blood, anyone ever heard of that? So the blood that's returning back to the heart, the pump is way up here, so it's not as effective down there, plus you have gravity. Well, those veins have little check stations in it, so the blood can't go back, but it doesn't move up very well. Things like putting your legs up a wall can help with that. But contracting your calf muscle is one of the single best things you can do because it helps to pump that venous blood back up the system so it can go to the heart and do what it's supposed to do and become reoxygenated. Lymph and venous blood will pull in the legs. Enzymes that regulate fat and sugar metabolism, they become less active. So using our second heart, our calf muscle, we can help support glucose control, venous blood return to the heart, the lymphatic system, and our overall health. Uh-oh, we got another movement break. So from your seat, where you are, seated ankle pumps. So we're talking about that's just your feet out and just pump your toes. Point and flex. You want to pull those toes back as far as you can and then point with some force. Back and forth. 20 seconds of work. We're just going to have to guess because I can't wear my watch. I mean, I guess I could, but it's really awkward. All right, and then if you want to stand, you can. If you don't want to stand, you don't have to. You're just going to march, right? Get in those knees up. Get your high knees moving. High knees. High knees. High knees. Stand. March in place. Get a little blood flow. Yeah. While you're standing, if you want to add a little bit, you can roll your shoulders. So we're marching and we're rolling the shoulders. Roll in the other direction. And you can just pause for a moment. Take your right hand, place it on your belly, your low belly. I want you to breathe in really deep, really deep. You feel the belly expand out. And then as you exhale through the mouth, force the air out. Deep belly breath. Forceful exhale. One more time. Deep belly breath. And a forceful exhale. Okay, you can set back down. Oh, stand back up. No, I'm just kidding. I'm just kidding. All right, so back to the science. We'll look at a couple of extreme conditions that can result from lack of movement. They can also result from damage to the lymph nodes during cancer treatments. You've probably heard of lymphedema. Lymphedema is swelling in the legs and ankles, arms or face, a feeling of heaviness or tightness, shoes or rings that don't fit. And lymphedema is swelling that happens when the lymphatic system cannot adequately drain the fluid from tissues. When that lymph builds up, it causes visible swelling, usually in the arms or legs, but it can happen anywhere. The face is a common one after sleep. It often develops after lymph nodes have been removed, such as cancer treatment, but it can recur also just with aging, inflammation, immunosenescence, infection, or long-term circulatory issues. There are actually stages of lymphedema. Yeah. Stage 1 is latent or silent. You may not have any asymptomatic issues. You may not even see the swelling yet, but you may feel the heaviness, the tightness, or subtle discomfort. This stage can last months, even years, if not addressed. Stage 2 is early and still reversible. Soft swelling may appear. Have you ever seen someone take their thumb and push on a swollen area? And if that area stays imprinted, then you have fluid accumulation in that area. That's a pretty good, it's called pitting edema. With early management, this stage is often reversible. Stage 3, spontaneously irreversible stage. Swelling becomes more constant, doesn't fully resolve with elevation, and the tissue begins to harden or thicken. And the reason that happens is because the fluid is taking up the space and the oxygen can't get there. So it's a hypoxic environment, meaning lack of oxygen. Intervention is still very important to prevent progression. Stage 4 Lymphostatic elephantitis is an advanced stage. Significant swelling, thickened skin, hardened skin. The skin may have hard creases and folds in it, and it may increase the risk of infection. Function and mobility can be significantly affected. Swollen lymph nodes. We talked about this briefly. These are the visible ones. They don't always indicate a sign of infection. In fact, the lymph nodes will hold stuff in there for surveillance, right? It goes through the lymph system. The lymph nodes kind of collects, sends the cells in to say, is this damaging? Is this not damaging? What do I need to do? So things can pull there, even though it may not be an acute infection or a scratch. When the body is sedentary, these can swell as well. And swollen lymph nodes are usually temporary, and they're a sign that your immune system is working. However, if they're persistent, these things should be evaluated by a healthcare provider. I mentioned that we talk about facial appearance. There are sleeping styles or positions that work best for the lymphatic draining of the brain, but facial appearance, anyone ever woke up in the morning, their face is just really puffy? So Dr. Andrew Huberman did an experiment where he had patients that self-reported slept well, took a picture of themselves, self-reported didn't sleep well, took another picture of themselves in the same environment, under the same circumstances, and to see those pictures, it's dramatically different. Sometimes simple movement, just walking around, is enough, but again, this lymphatic and facial appearance can be from lack of sleep. It could be for other reasons, not sleeping well. Maybe your head is propped up, which doesn't encourage drainage, or your head is tilted down, which doesn't encourage drainage. It's usually not fat, although women be like, oh my goodness. It's often fluid retention. Daily habits that help. You like those? As we finish up today, I want to leave you with a very encouraging message. And I know there's been a lot of scientific stuff, but as I've stated before, you don't need extreme workouts or complicated routines to support your lymphatic system. In fact, the lymphatic system responds best to small, regular habits done daily. So get your muscles moving, work on your breathing, increase your daily activity. That means every time you stand from a chair, walk down the hall, do a few ankle pumps, take some deep breaths, join an exercise class. We have room in the exercise classes. Those are available to you. You're helping your lymphatic system move fluid, remove waste, and support your immune system, and possibly improve your appearance. Because the research is clear that frequent gentle movement throughout the day is your body's best defense. Small movements done consistently create big benefits for your overall health and well-being. Get moving, don't make excuses, and have a can-do attitude. Key takeaways. Movement is medicine. You can write your own prescription right here today. Sleep clears the brain, and exercise supports healthy aging. The next slide is the references. I have that available for you so you know that all this is rooted in science. I try not to delve too deep into biology for my sake and yours as well. Certainly if there's topics that interest you and you want a deeper dive, I can help you find places that make that information available to you. But open the floor to question. I need my microphone runner, please. She's coming.
I have to run.
Be careful. I think if you go past that back speaker, it'll start to yell at you. So just see what happens.
Oh, okay.
Yeah, run.
Okay, all right.
Go. Go.
I have a question concerning the lymphatic system.
Okay.
You said that it moves up to 4 liters of liquid a day,
Yes.
and where does it go? Where does the lymph system get rid of all these bad things that it's carrying around?
Well, some of it gets put back into the bloodstream, as I mentioned, but not all of it gets back into the circulatory system, and not all of it you would want to. But sweating, which is why sweating is such a great detoxification, sweating, saliva, urine, feces, all these ways that we detox. Oxygen, right? Breathing, carbon dioxide.
Does intake of water help on the lymphatic system and getting rid of the waste? Taking in more water?
Increasing your water intake or having adequate water intake affects every cell in your body. So it absolutely does, yes.
Ladies first.
I did do a presentation on sleep. I kind of heard that question out of the corner of my ear. How do we get better sleep? How do we get good sleep? There is a presentation on sleep, and I believe it's on the ARC portal. There are some suggestions there. Certainly some things that can help. They may not improve all of your issues, but hopefully you'll find that helpful. Yes?
That was my question. I missed that one.
Okay.
But how much sleep do we need, and can we sleep too long?
I would say how much sleep you need varies, and I don't have my information in front of me, but I think the going numbers are 6 to 8 hours of sleep. If you're younger, that can be different. If you're older, that can vary some too. Things like keeping your room at a cooler temperature can help with sleep. If you're waking up frequently throughout the night, not flowing on the overhead light, which I know we've got to worry about safety, but having that floor lighting, right? Trying not to wake up the nervous system, not sleeping with your phone. Anybody do that? Going to sleep with the phone or a computer, that blue light. You want to stop that several hours before you go to bed, right? Because the nervous system is excited, so it makes sleep hard. And there are a lot of other factors like that. If you missed that presentation, I can print out the handout from that to help you out, or you can find that on the portal.
Hello.
Hi.
Can you hear me?
Yes, sir.
All right. You mentioned appearance. What can you do about varicose veins?
Well, that's another lecture, sir. Anyone have a question? It doesn't necessarily have to be this, but
Need to exercise.
This may be too technical, Carrie, but do you know the difference between lymphedema and lymphoma?
lymphoma is a cancer of some sort.
That's what I
Lymphedema
had.
is the swelling, yeah. Yes.
And I had 2 liters of fluid removed from my lungs.
Yeah. So the fluid gets to a place that it's not supposed to be, and that can be
Yeah.
very problematic. Yes, sir. I'm sorry to hear that. We're glad you're still here, though. You're a great example. And I didn't mention this in the presentation. There's so much information, and when I'm preparing these things, I listen to qualified doctors and people talk about the same topic. Swimming is actually one of the best exercises you can do for lymphatic movement. Some of the lymphatic vessels are very superficial, and they're very small, so you don't want hard pressure, but the water flowing over the skin is one of the best exercises you can do for lymphatic movement. Treading water is another one. Rebounding, which we do have a trampoline up in the gym. It's not for everyone. There is a note on it that says you need clearance before you get on it, so please abide by that. But yeah, I just thought I'd throw that in since you're an avid swimmer.
Yeah.
Anyone? Burning desires? Oh, we got one over here. Make her go from side to side. When she gets over, you don't even have to have a question.
Would you mention the podcast that we talked about the other day, the doctor's name?
Dr. Mark Hyman? Yes, Dr. Mark Hyman has a podcast. I don't know where you get your podcast. It doesn't have to be on an iPhone or whatever app you use, but he's an extremely reputable functional medicine doctor that has lots of great information. Dr. Andrew Huberman, I have a hard time saying that name. He is also another great one to follow. He's a neurobiologist and ophthalmologist out of Stanford. Great information. Huberman. Andrew Huberman. And Mark Hyman, Hyman. Huberman, I think. If you get close enough, usually the internet will find it for you. Anyone else? If you have questions you didn't want to ask in a public forum, you want to come up and talk to me afterwards, I'll be here for a while. If there's any way that I can assist you, I'm always here to help. I just want to say one last thing. You have an amazing resource in the fitness center. You don't have to go there to exercise, but you can, and I'm there to help you in any way that I can. So So on that note, thank you guys for being here. And we'll look forward to March.
I already got my second exercise.
I think there's one over there, Karen. There's one over there.
What?
I'm just kidding. She's brutal.
Carrie, the hardest thing I do is stand up. I'm going